And thanks so much for joining us on our first COVID-19 press briefing of the week. Today, Orange County Mayor Jerry L. Demings will give a status update of where we are both on testing and on vaccinations, and how residents can utilize county services, get tested and vaccinated. The mayor will also have details on rental assistance, locations of the I Got My Shot trailer, and other details. Orlando Mayor Buddy Dyer is also here with other important details on the city of Orlando. Dr. Raul Pino from the Florida Department of Health in Orange County is also here with important trending details. Dr. Barbara Jenkins, OCPS, Superintendent of Schools, is here with important details also on our children. And Phil Diamond, Orange County Comptroller, is here with a report on TDT revenue. We have a lot to accomplish today. We'll begin with Mayor Demings. Mayor?
Thank you, Dr. Williamson. Thank you to all of you for being here. I pray that you had a fun-filled weekend and that it was a safe weekend as well. We continue to see a significant increase in the number of new cases here within Orange County as well as all across the state of Florida. I want to start out with an announcement designed to help our community as we work together to slow the spread of the novel coronavirus here. We continue again to see approximately 3,000 people a day desiring to be tested at our county-sponsored testing sites. As a result, a third testing site will be opening tomorrow morning at the Claricona Elementary School in Apopka. The site will be drive-through only with rapid and PCR tests available. This new Apopka testing site will provide service to the northwest portion of Orange County. So now there are 3 testing sites: Barnett Park, the Econ Soccer Complex, and again, the new Northwest site. Our hardworking Orange County Health Services workers and employees will be running these sites. All 3 testing sites will operate 7 days a week between the hours of 9 a.m. and 5 p.m. They will be open through the end of the month, at which time we will assess to determine how best to move forward at that point. We strongly suggest that you get to each of these sites before noon, as capacity is generally reached early afternoon. There are no walk-ups allowed at these particular sites, so we do ask that a maximum of 4 individuals be in each vehicle. We continue to see approximately 150 people being vaccinated daily at Barnett Park. 70% of those being vaccinated are receiving their first dose, which is the largest single-site vaccine location in Orange County. Our county retail outlets continue to also provide vaccination opportunities. Of course, we're talking about our retail pharmacies, etc. And for a new announcement, the second announcement I'm making today is that I'm pleased to share that Camping World Stadium will now be the site of a drive-through only vaccination site. This vaccination site will also open tomorrow morning at 9 a.m. and operate 7 days a week. We have contracted with CDR McGuire to operate the site, which will be managed in partnership between the City of Orlando and Orange County. So let me just thank Mayor Buddy Dyer for the partnership there. This means that beginning tomorrow, Barnett Park will no longer conduct vaccinations at that location. Again, beginning tomorrow, Barnett Park will no longer offer vaccinations. They will be only offering testing opportunities. Again, all testing will shift to Camping World Stadium starting tomorrow morning. Both the Pfizer or Johnson & Johnson will be offered. We want to make the vaccination opportunities more convenient by offering drive-through services like the ones that you saw at the Orange County Convention Center. That was a highly successful model for all of us. We also must join together to get a handle on the latest surge in cases, and so you're going to see additional partnerships throughout the county. I'd like to give you the goals for this week. Number 1 is to slow the spread of the dangerous Delta variant in our community by getting as many people vaccinated as possible. Number 2, to have more testing sites available and increase access to vaccines. 3, continue to offer financial assistance to rental to rent-stressed residents through our emergency rental assistance program. And number 4, to continue to work with our businesses so that Orange County is not harmed economically by this latest surge in cases. In terms of the numbers, Dr. Pino will get more into the numbers, but we have over 179,000 cases of the novel coronavirus reported within Orange County alone. That is an increase of nearly 5,700 cases since our news conference on Thursday last week. The Department of Health reports that as of Friday, there were 1,458 new cases in Orange County. 99.5% of these cases were among unvaccinated individuals. Sadly, 15 additional residents have died from the deadly disease since our briefing last Monday. Our 14-day positivity rate stands at 19.72%, which is much higher than we want to see. As for the numbers of residents ages 12 and up who have at least one shot of vaccine, approximately 64.33% of our residents have received at least one dose. I also want to remind you that our rental assistance program remains intact. As of this morning, more than $6 million have been approved for families and individuals to catch up on their rent payments. Here through Orange County, we're offering up to 12 months of past due rent and $20,000, or up to $20,000. In just a few moments, I know that Mayor Dyer will talk about the efforts within the city of Orlando. To make sure all residents have an opportunity to get vaccinated, the I Got My Shot mobile vaccine trailer is still moving throughout the community. Today, the trailer will be located at the Savannah Court, which is in Maitland at 1301 Maitland Boulevard, between the hours of 1 and 4 p.m. Tomorrow, Tuesday, August the 10th, it will move to Kelly Park in Apopka between the hours of 9 and 11 a.m. Tuesday afternoon, the mobile trailer will be at the Jackson Neighborhood Center on Carter Street between the hours of 3 and 6 p.m. On Wednesday, it will be back at Lake Eola in the morning, and in the afternoon on Wednesday, the trailer will move to the Wadeview Neighborhood Center on Summerlin Avenue. On Thursday morning, the I Got My Shot mobile trailer will be located at the Roseville Farms on Puncan Road in Apopka. So there are many opportunities to get vaccinated. And now I'm going to turn it over to Mayor Buddy Dyer for additional comments.
Thank you, Mayor Demings. I want to start by saying thank you to our community, especially thank you to those of you who have gotten vaccinated. But I also want to thank the medical professionals and first responders who continue to do an amazing job for our community. Thank you, Mayor Demings, Orange County, Dr. Pino, Florida Department of Health, for the strong partnership that's going to allow us to continue doing vaccinations at Camping World Stadium. And thank you to the residents for wearing masks. It's a difficult time for our community, and our care and compassion from our citizens is on display daily. So I want you to understand that we're now in the voluntary phase of the pandemic. You can opt out by getting vaccinated, or you can decide to participate by not getting vaccinated. So it ought to be pretty clear. The best protection against COVID is to get vaccinated. It works, and it protects against serious illness and death from the virus. If you haven't gotten your vaccine, it's time to do it now. So in addition to the Camping World site that Mayor Demings mentioned, we continue to have vaccine sites at our city neighborhood centers and our facilities. This week, the trailer will be at tomorrow at the John H. Jackson Center. Wednesday, as Mayor Demings mentioned, Wadeview. Friday, we have a site at OPD headquarters, and then on Sunday, the Farmers Market. And they will be offering both Pfizer and Johnson & Johnson. And as Dr. Jenkins will tell you, as school's starting, it's a good time for those that are 12 to 17 to get vaccinated. There's no pre-registration at any of our sites. So if you want to get more information on that, visit orlando.gov/mobile vaccines. And as to our rental assistance program, we have encumbered $2.7 million, which is about 1/3 of the money that we have available for 550 families. Dr. Pino?
Good morning, everyone. So a lot of information to give out. It could be a little bit of discrepancy between the data that I'm going to give you and the data that the mayor just gave you because I received it on my way here. So didn't have the time to conference with the mayor, but wanted to give you the fresh information that we have. But the difference is not much. So for the total number of cases, we are at 179,192. And our 14-day average as of today is 19.7. We have 1,426 deaths, and the ones that we are reporting today are from the age to 54 to 91, with a median age of 73. Those are 9 additional deaths, 4 female, 5 male. 3 had pre-existing conditions, 6 we don't know. One of the deceased has an address as an assisted living facility. And with the total number of cases for yesterday, I was looking to some data there, so that's why I got to slow down a little bit. Yesterday, we received 1,038 new cases. That's Sunday. And on Saturday, we received 1,197 new cases, and on Friday, 1,458 cases. Our rate per 100,000 is at 573, and out of the cases that we received yesterday, 99.5% were unvaccinated. The ages that have the highest contribution to the numbers yesterday were from 5 to 44 years old. I also want to give you some information on vaccinations. Yesterday, reported so far 1,684 vaccines doses were given in our county, and our rates are as follows. For 12 to 17, we have increased to 48.8%. For residents eligible, of all between 12 and up, we are at 64.3% for 1 dose, and completion at 54.37%. We also receive guidance from the state with regard to how the protocols are going to be handled for the schools as the school year starts tomorrow. Now, this is the initial guidance. We could receive further guidance to clarify some of the issues here, but this is in general so that the public has an understanding what to expect. And of course, we will be posting these tomorrow in our website. So for students who are positive, this is only for K to 12, as it is in the emergency ruling that we received from the State Surgeon General. Any student can return to school after being positive for COVID-19 if the child is asymptomatic, meaning no fever or any other symptoms for 24 hours without medication, and if he has a negative test. At any point after being diagnosed, if a student has a negative test and is asymptomatic, they can return to school. Now, a student can also return to school after 10 days from being diagnosed. That means coming out of isolation. And students can return to school at any point during the isolation period if they receive a note from a licensed provider on the Florida statute that attests that the child is ready to go back to school. Now, a student that has been exposed to a positive case, those are, as long as they are asymptomatic, they can have a test on the 4th day of the quarantine and come back to school next day if that test is negative. Meaning, at least a child who is in contact with a positive confirmed case will be at least in quarantine for 4 days. After that, they can have a test and then come back to school if that test is negative and the child is asymptomatic. Also, a student can come back from quarantine after 7 days if they are asymptomatic, no test needed. So from both cases, we have a test option, we makes it shorter, and a non-test option that makes it a little bit longer. Now, if during this period, any student becomes asymptomatic, meaning while they are in quarantine, then they go back into the protocol again to follow those rules. Now, a student that has been in contact with a positive case, but this student had COVID-19 in the last 90 days, means the person has some level of immunity, then they don't have to quarantine as long as they are asymptomatic. If they become symptomatic, then we start all over again the process. I know it can be a little bit confusing. It's confusing for us. We will get it right. We will memorize it. We will post it online. We will share with the Department of with the superintendent and the schools, and we will all do it the right way. We have done this before. We can do it again. Our department is ready to engage in this process with the Board of Education. And also, we are going to increase the number of hires. So in our website, which is www.orange.floridahealth.gov, at the end of the webpage, there's an address where you can send your resume if you would like to become a trace investigator, a contact tracer, or if you have nursing or public health experience or degrees that we can train you to increase our employees as we engage with the school system and others in trying to make it as safe as possible for everyone to live their lives. Thank you. Superintendent, I forgot to introduce you.
Let me just say, after going through all of those quarantine particular rules, I will forgive forgetting to introduce me, Dr. Pino. Let me also say, because it makes my head spin, let me also thank Mayor Deming, Mayor Dyer, and Dr. Pino for incredible leadership they have brought to this community during the pandemic. And again, I especially want to note all of those quarantine rules. Do not ask your principal, do not ask teachers. We will allow FDOH with their expertise to deal with those quarantine issues. Let me just cover a few facts for you. 209 students will be coming back to school tomorrow. I'm waiting on the report to see how many showed up today. Tomorrow is the first day of school. We look forward to welcoming both our students and all of our employees that are 10-month that have been out. 24,000 employees, and our goal, the board and my goal, is to make sure it's as safe as possible under what we are provided with our authority. We are up about 3,000 students compared to last year. Last year, you will recall, we were down in our enrollment thanks to the pandemic. We will open 4 new campuses. In case you hadn't heard, 2 new high schools on the west side of town tell us that there is an extreme growth initiative happening out there. Silver Pines Academy in the Pine Hills area for our special needs students, and Village Lake over in the Lake Nona area. I want to absolutely thank all of our teachers and staff who have worked tirelessly to prepare to welcome our students, from the bus drivers to the cafeteria workers, custodians, secretaries, everyone in that school setting, especially the principals and assistant principals, getting ready for our students. So let's talk about those masks. When we had our safety press conference on Friday, I said to the group, we have 2 calls taking place today. We have to be fluid. Things may change, and indeed they did. So as we have announced to all that were on our Connect Orange messages on Friday, we have made an additional provision. We provided previously that all adults, all of our employees, had mandatory face masks, and that any visitors on campus would be required to wear a mask as well. Volunteers and folks who help us out with our children, we desperately need them back in place, but they need to wear a face mask while they are inside our buildings. On Friday, we got additional information from the Department of Education, new rules adopted from the Department of Health, including those extensive quarantine guidelines that you heard Dr. Pino mention. And so Friday afternoon, late Friday afternoon, we made the provision that all of our students are required to wear a mask inside our buildings as well, unless the parent provides an opt-out notice. That means simply a parent can send Harrison to school. I'll use Harrison because someone's child is named Johnny. My child is Harrison, but he's an adult. So if Harrison is coming to school and I've decided I don't want him to wear a face mask, all I need to do is send a simple note with Harrison. It can be a one-liner. I have decided to opt out for Harrison wearing a face mask. Signed, Barbara Jenkins. As simple as that. That's all we are looking for. We're not going to make it complicated. We're not going to make it extremely difficult for parents to opt out. We respect those parents' choices. While we strongly encourage the use of face masks, a simple one-sentence note is all that they need to send in with their child to make that provision a reality. Let me be clear as well, because the question came up today. That opting out is only for our students. We still have mandatory masks for the adults on our campuses, and certainly all of our employees. There is no opt-out for those populations. That provision is in place for 30 days. After 30 days, we will continue to consult with our medical experts, Dr. Pino, our MAC chairman, and others. We will consult, and before the 30 days are up, we will make a determination on how to proceed. I want to encourage folks to look at all of the information on our website. We have FAQs about the opening of school and lots of COVID information on ocps.net. Also want to reinforce we have other provisions, mitigations in place to help keep our schools safe. Certainly the number one request that we have is if a child is not feeling well, please keep them home. Do not send a child to school if they're not feeling well. The best strategy is to keep them at home until we know what's going on. Employees as well, we ask them not to come to school if they are not feeling well. We have frequent cleaning and disinfecting, hand washing, sanitizing, social distancing as feasible. I want to be very clear, we don't have enough space to have everyone 6 feet apart. At the end of last year, about 80% of our students were back in face-to-face instruction. We expect more than that for the start of this school year, but we will distance as much as possible. That is why face masks are encouraged, because we cannot guarantee 3 to 6 feet. It is as best as feasible as possible. I also want to encourage folks to take advantage of the free testing. We are hopeful we'll have announcements in the coming days of additional partnerships for free testing, and encourage those who are willing to consider the vaccination in consultation with their health care providers. While periodic temperature checks may not be the greatest strategy for finding those children who are not well, we are going to have periodic temperature checks as well. Vaccination sites are increased thanks to a partnership with Health Heroes. We are setting up and announcing more dates this week. Since the end of April, more than 8,600 people have received COVID vaccinations at one of our sites, so we're pleased to start increasing those efforts. Again, encourage to those who are eligible, but not required of our employees, and certainly not required of our students. We do have a $200 incentive for our employees. No matter when they got the vaccination, they can go on our wellness portal and receive that incentive if they have been vaccinated. Lots of information is available. I mentioned our medical advisory committee. We still have the video Ask Mac, where they answer very sound questions around the vaccination. Highly qualified group, medical advisory committee, can still be viewed with their answers to some of those questions. Again, if you have concerns, you consult your own healthcare provider. A little bit of additional information. We've got dozens of links on ocps.net. Want to remind parents, if you have digital devices, that would be our middle schoolers and high schoolers, please turn those devices on before they come back to school tomorrow. All of our updates will be downloaded automatically, even though you are at home. Got to turn it on today so that you can get those uplinks and those updates. Otherwise, when you get to school tomorrow, and we use our laptops during the regular school day, even in face-to-face, you will find the machine is frozen up trying to take care of all of those updates. So turn those laptops on today. Lastly, transportation, I want to mention we have, for those who actually qualify for transportation, it will be available starting tomorrow. Ask for additional patience as we get our bus stops and run times together. And I would ask again, as we did last year, if you are able to transport your own child, even though they require or qualify for busing, we ask for parents to help us out. That will help us spread students out on the buses more readily if we have fewer students who actually come to the bus stops. Air vents will be open, roof vents will be open, windows, trying to make it as safe as possible. You can help by transporting your own child if at all possible. And lastly, food services will be up and running for any child who is quarantined or away from the school. We will still have provisions for their lunches to be provided for them during this time. Lastly, I want to stress again, we depend on our entire community to help keep our children safe. If you see something, say something. Can't say that often enough. Practice caution as you're driving around schools and in the neighborhoods, because walkers, bike riders, bus riders, and more will be out in large numbers. So we're asking for everyone to help keep our children safe. That being said, I'll turn it over to Comptroller Diamond.
Thank you, Dr. Jenkins. Good morning, everybody. I'm here to report on the June tourist development tax numbers. Bottom line is the numbers were good. We collected about $21,717,000 in the month of June, or for the month of June. That is the highest number we've had since the beginning of the pandemic. It is still below the levels of 2019, which was our peak year, but it is roughly equivalent to what we did back in 2017, which was a good solid year. On the expenditure side, the month of June was the second month in a row where the county did not have to use reserves to offset its TDT spending obligations. As shown in the cash reserve summary, which you all should have, our reserve account increased by about $1.5 million for the month of June. However, even though we added 2 reserves in June, I'd remind you that we've used about $143 million of reserves since the pandemic started. And as you'll see in our other chart, which is available on the poster board and in our handouts, our reserves in that area have decreased from about $180 million to about $37 million during that time. And just to put this in context, the numbers from this month and the overall numbers, in order to replenish our reserves to where they were before the pandemic started, we would need 96 consecutive months of $1.5 million surpluses to get back to where we were. That's about 8 years. So while the month of June did bring good news for us and with respect to TDT collections and reserves, the months of July and August, and as you all have heard this morning, we're clearly not out of the woods yet as we see cases increase in Orange County. Currently, Florida leads the nation in coronavirus infections. And in Orange County, our positivity rates and new cases have been at all-time highs. This doesn't bode well for our longer-term outlook. However, the county's efforts to increase vaccinations and reinstitute safety precautions are critically important to ensure not only our public safety, but the health of our economy. And I'll be happy to take any questions during the question period, and we will have our numbers for July sometime in early September. Thank you.
Okay, with that, we are joined today by several of our Orange County Commissioners, Commissioner Nicole Wilson, Commissioner Myra Uribe, and Commissioner Maribel Gomez-Cordero have joined us. Also have Mr. Mark Tester, the Executive Director from our Convention Center, is here. Mr. Ed Torres, our Utilities Director, is here. We also have Director Danny Banks, our Public Safety Director, who has joined us, and then any of the speakers who have spoken at this point are available to respond to any questions, and perhaps towards the end, depending upon their schedule, they'll be available for one-on-ones. So with that, I'll open it up. There will be a microphone that will be moving around so that for television purposes, we'll be able to capture the audio. And with that, we'll open it up for any questions. The mic is here, so.
Lauren Seabrook, Channel 9. Is this on? Can you hear me? Dr. Jenkins, my question's for you. After the requirement on Friday for masks, many parents were asking us, what's the real difference between what it was before and what it is now? I understand it's called a requirement, but with the opt-out option, many parents view that as the same as being optional. So I'm curious, in your eyes, what do you think the difference is, and do you believe you'll see more students in masks now after the change on Friday?
So part of that question certainly would need to be answered by the folks at Department of Education who made that shift on Friday. Don't want to speak on their behalf. In my view, it still gives the same option to our parents that we had previously, but I think it also sends a very important message that, based on what our health experts are telling us, we believe it ought to be required, but we also respect every parent's right to opt out. I think that message is being sent clearly, that things are more serious than previously determined. And perhaps potentially more parents will decide to send their children in masks for the first 30 days. I respect every parent's right to make that decision, and so does the board.
This is Steve Hudak from the Orlando Sentinel. This question's for, whoa, sorry about that. For the mayors and for Dr. Pino. What's your level of concern with the variant that we have right now and the conditions we have right now? What's your level of concern about UCF coming back to campus next week? And what can we do about it?
Dr. Pino, if you'll come to the mic.
So, you know, the guidance sent by the Department of Education and the Department of Health only apply grade to 12. The concerns with UCF or any other environment where these young people are congregated, it is the same that we always have expressed, that they have to take necessary steps to curtail infections. They did it at the end of the last school year, and I hope that they will continue to do it as we go through the school year. But we should expect the same type of concern that we saw before, especially with outside school activities, the bars, the clubs, the nightlife activities where people get concentrated in very small places. Less concerned about the school itself, but more concerned about the activities of those age groups that are, you know, in environmental highly transmissible variant, what it could happen.
This is Melissa Thomas.
Steve, the only thing I would add is that obviously we have seen, you know, around the country, different universities in high transmission areas making adjustments where they're requiring mandates. I believe that the University of Central Florida is obligated to look at our specific experience here within our community and then make some adjustments. They have to listen to the medical experts. Of course, the University of Central Florida has a med school. They have researchers, and we have relied upon much of the data and the studies that they have done about the transmission of the virus indoors and outdoors. And given the current state of affairs with the Delta variant, some things perhaps have changed, but I'm confident that once they hear from their experts, they'll make the appropriate decision. Okay, and we'll open it up. You got it.
All right, so this is Melissa Thomas of Florida National News. This question is actually for Mr. Tester. It's a question about the convention center. Absolutely. Thank you. So, Mr. Tester, my question for you is, given the increase in numbers here in Orange County this year compared to last year, are you seeing the same rate of cancellations for the events? We know we had some recent cancellations from the convention center. Are they happening at the same rate this year as they did last year?
They're not. They're not. They've slowed down very significantly. Last year at this time, the majority of our events did cancel. At this point, we've had 4 recently that have canceled. So.
I think that part of the reason there is the fact that a significant portion of our population has been vaccinated at this point. So I believe the state of affairs is different, even though we see the surge that is going on now. 64% of our population has received at least 1 dose, and then across America, we know that better than half of eligible Americans have also been vaccinated at this point. So certainly it's a different landscape than we had last time, and we have an abundance of sanitary protocols in place at our convention center. And Mark, correct me if I'm wrong, but all of our shows and show organizers are requiring the wearing of facial coverings, et cetera. Okay. The reference that same issue?
Convention center, yeah.
Okay. One more question over here regarding the convention center.
Sorry, thank you, Mark. Greg Fox at Channel 2. So I know that the convention center often has economic deals with people that come into the center on infrastructure and things that they need for shows. Are you finding that still in this COVID environment, the convention center's having to work pretty hard to cut good deals with people to make sure that they bring their people to our city and our county?
You know, most of the deals that we've done have been well in advance, so years in advance, unless they've rescheduled their event this year. It's still a competitive environment. Some of them have asked for additional help, like with labor and things like that, and we're taking them on a one-off basis, but that would be very small amounts of monies.
Ashley Edlin with Channel 9. I think this question is going to be for Dr. Pino. Mayor Jennings, you mentioned that we're seeing around 150 people a day come to Barnett Park to get vaccinated, but we're also seeing out in the media that there just aren't enough people throughout Florida coming to get vaccinated. Can we speak to the progress now that we're seeing in terms of the percentage of vaccinations throughout Central Florida?
So I cannot speak about Central Florida. I can speak about Orange County because, don't have that data in front of me. We have seen an increase in the demand for vaccines. Now, the numbers that I offered may not seem like a lot, like 1,600. So what had happened now that didn't happen before is that we are seeing more first doses than second doses. So that's a good thing because that talks about intake at the first dose. The other thing that I have to say is that those numbers are always provisional because not everyone enters the data the same day that the vaccine was offered. They have a time frame, so sometimes those numbers get up as the days goes by. But just to give you an example, our mobile unit that the mayor mentioned where it's going to be has increased from 20, 25 vaccines that we were giving any given day to sometimes 150 with the same unit in locations. So there has been an increase. How big it's going to go, I don't know. I think it will continue to increase. And our major increase has been also in an age that we are very interested in, 12 to 17. We have seen an increase, slow, but it has continued to increase over the days. And that's also part to the work that the Board of Education is doing with Florida Hero, Health Hero Florida's, navigating and going through the schools and offering vaccinations at those sites.
So add is that one of the reasons why we are moving the vaccinations to Camping World is it helps to relieve the backup at the Barnett Park because we were doing testing and vaccinations there. And by focusing on just doing the vaccinations at Camping World, we're able to move people through, we believe, much more efficiently. Perhaps one of the reasons or the reasons why individuals were not going to Barnett Park was because of the long length of time that they had to wait. And so we believe that we'll cut that time down. It'll be a process much like what you saw at the Orange County Convention Center, and it also will create the opportunity for as many as 750 individuals to get tested on a daily basis there at Camping World, and it's conveniently located. We believe that it's still in the heart of the county, and as a result, we should see positive rates go up. Okay.
Hey there, a question for both. It's the same question, but I'd like an answer from Dr. Pino and Dr. Jenkins, if possible. You know, we had posed the question on Friday about just so much uncertainty going into the new school year. Then the mask changed late Friday, and now we have new guidance from the CDC. I'm sure parents are going in a little anxious into the new school year with so much that's changing. How are you guys feeling going into the new school year, and how can you ease those concerns for parents, students, and teachers?
So I understand, because we have experienced the same. It got here for Friday for us, and more guidance will be coming today, and resources will be released tomorrow. So it's rolling and rolling and rolling. Part of, but you know, what people have to have in mind is that we have done it before. We had another school year in the pandemic last year, and we did very well. At the beginning, we had some bumps with the whole protocols and procedures, who said the information, but that's normal in this type of environment. And that same machine is the machinery that is in place today to start tomorrow. It will get better as we get resources. It will get better as we add individuals, but the structure is there to offer those services to our community the same way that we did before.
I couldn't have said it better than Dr. Pino. I think it's helpful to remember this nation, this world has not gone through such a pandemic for the last 100 years. And so we forget quite easily how challenging last year was, but we did get through it. And so I would just say to parents, we have to, I used this term last year, we'll use it again. There has to be a high tolerance for ambiguity and for the fluidity of what will take place based on what comes down, because it is still a pandemic. But I would reassure both students and parents that the school board and I are committed to keeping our schools as safe as possible and reacting to information as it is handed down to us from the state level. And again, certainly appreciate the tremendous partnership with our local Department of Health and Dr. Pino's team. They are invaluable in helping advise us on how to get through this.
Buenos días. Buenos días por acá, Félix Pirela de Telemundo 31. Mi pregunta va para el doctor Raúl Pino. Quisiera que nos explicara para nuestras comunidades hispanas, ¿no?, cuáles van a ser los protocolos que el Departamento de Salud está recomendando para el regreso a clases de los niños, de llegar a darse un infante positivo por COVID-19.
Sabes que no había pensado en esto en español, así que voy a tenerlo que traducir on the fly. I was saying that it's interesting. I didn't think about this in Spanish, so I may have to translate on the fly. Para nuestra comunidad latina, el viernes recibimos instrucciones del Departamento de Salud del Estado acerca de cómo vamos a manejar los protocolos para aislamiento y cuarentena. En el caso de aislamiento, que se refiere cuando una persona es positiva, entonces un niño que es positivo o que da positivo un resultado puede regresar a la escuela cuando no tiene síntomas por 24 horas, no fiebre, no dolores de cabeza, sin ninguna medicina, y tiene un resultado negativo. Esa cualificación ahí no tiene ninguna limitación de tiempo. El niño puede ser 3 días desde que se diagnosticó, tiene la prueba negativa, no tiene síntomas, puede regresar a la escuela. Un niño también puede regresar a la escuela después de 10 días en el aislamiento. Y ese es el protocolo normal sin ninguna prueba requerida. 10 días después del contacto. Y un niño también puede regresar a la escuela si su médico la enfermera o un proveedor que esté licenciado, de acuerdo a las estructuras en Florida, manda una nota de que el niño está listo para regresar a la escuela. Ahora, para la cuarentena, quiere decir para aquellos que están expuestos a alguien que es positivo, pero la persona es negativa. El niño puede regresar a la escuela después de 4 días en la cuarentena si no tiene síntomas y si tiene una prueba negativa. También el niño puede regresar a la escuela si está asintomático y han pasado 7 días desde que se puso en cuarentena. Aquí también tenemos 2, con una prueba, 4 días negativa, y sin prueba, 7 días. Y también si el niño en cualquier periodo de la cuarentena desarrolla síntomas, tiene que regresar al protocolo y volverlo a iniciar nuevamente de acuerdo con nuestra guía. También los niños que han tenido COVID en los últimos 90 días y se exponen a alguien que es positivo, siempre y cuando no desarrollen síntomas, no tienen que ponerse en cuarentena. Apenas se desarrolle, entonces el protocolo comienza nuevamente. Yo sé que es complicado, pero todo esto va a ser trasladado al español y también lo pondremos en nuestra página.
Jeff Allen with Spectrum News 13. This question is for Dr. Pino. It's my understanding Florida is either leading or close to leading the country right now in new pediatric cases of COVID-19. Can you say what you can? I know it sounded like age 5 was the lower end of the age range of cases. Can you detail any other information you can say as far as the new pediatric cases we're seeing and that trend?
Are you talking about hospitalized children? Yeah, I don't have currently access to the hospitalization data, although we are receiving constant information from all the hospitals. We are trying to set up that again. It will take a little bit because there's a lot of confidential information in that data that have to be scrubbed before anyone else can see it. There has been an increase in the number of pediatric cases, and to a degree, we were expecting that in the sense that it has happened a little bit earlier because of the Delta variant. We would expect that case will be after starting school, that we will see a bump in the number of cases. I don't know the volume or the occupancy of pediatrics ICU beds, but it continued to be a challenge, of course, and that's why we continue to work directly with the Board of Education and our public schools at the state level and the regional level so that we can provide a safe environment for the kids. But I don't have particular data on hospitalization for children.
Okay, the next question for you, Dr. Pino, comes from Jennifer Markel with the El Sentinel newspaper, and her question is, Florida COVID cases have become a huge concern for many, including Dr. Antonia Colello, a Puerto Rican physician and public health administrator who served as 14th Surgeon General of the United States. Today, she urged Puerto Ricans not to travel to Florida as it has become the epicenter of the pandemic. Many people from Florida travel back and forth to the island as well, becoming a huge risk of transmission. What is the take on the situation from a medical point of view?
So there are risks to any travel to any place that is experienced the pandemic, not just Florida. We may have more cases today. It could be someone else tomorrow. The pandemic, as we learned in the past wave, doesn't perform the same way in every single state all at the same time. Meaning we could be the highest today, it could be Connecticut in 10 days. Saying Connecticut because I'm from there. But it could happen to anyone. With regard to travel, there are guidance in place by the federal government on how to safely travel. So as long as people follow those guidance, I think they can safely travel anywhere. But that's an individual decision that individuals have to make. If you are vaccinated, it's an easier decision. If you are not vaccinated, there are some additional safety measures that you may have to put in place yourself to travel safely.
The next question for you, Mayor Deming, is from Ryan Lynch from the Orlando Business Journal. Hope you're doing well. For employers who may still be remote, do you expect the Delta variant to push return to office dates?
I have no way of knowing the answer to that question. I think we are in this dynamic environment where each day we see some new developments related to the Delta variant as well as the other variants that are out there. And so what I would encourage our business community to do is to listen to the health experts and make adjustments accordingly.
Question is for Dr. Jenkins, coming from Eric Mock with News 13. Dr. Jenkins, he asks, if parents can opt out of the mask mandate, what has really changed since the board had made them optional? And do you think it adequately will help control the spread?
So I think I may have answered that. Let me just try it one more time. So we believe, first of all, I cannot speak to what Department of Education, Department of Health at the state level had in mind when they made that adjustment on Friday. We nonetheless are held to those rules, those laws, those guidelines. I suspect that the implication might be a required face mask with an opt-out places a greater requirement on those who want to opt out, that they have to proactively make that statement that they wish to opt out. My guess is that's sending a subliminal message that our concerns around the Delta variant and COVID-19 are growing or more severe than what may have previously prompted face mask optional to becoming face mask required with an opt-out. All of the particulars around what thinking went into that provision by the state, I would have to let someone from Tallahassee answer. Let me also mention that our parents, anyone who's curious, always go to our website, ocps.net. You can get information there. We will be using social media. Follow us on Facebook. We will keep you up to date as we get new information.
Yeah, one more, I think.
For Dr. Pino, please, Andreina from Univision. I would like to get a message for parents. Tomorrow start the classes si lo puede decir en español, por favor, un corto mensaje para los padres en orden, en el sentido de que no estén ni muy nerviosos, ni muy en pánico, pero tampoco, o sea, que tengan la conciencia adecuada para tomar las decisiones correctas con sus hijos.
So the question was, what is the message for the parent with regard to if there is no need to panic? What is the right attitude in this process? Miren, la cosa está en que nos ponemos nerviosos porque la información está cambiando constantemente. Es normal. Y nos ponemos nerviosos porque los niños tienen que ir a la escuela. Lo que yo le digo a los padres, infórmense, busquen la información adecuada, hay suficiente información y haga una decisión de cómo usted va a proteger a su niño y a su familia. Es una decisión familiar, evidentemente, con este opt-out, y las personas tienen que decidir lo que es mejor para ellos. Lo que a mí me preocupa con las familias nuestras es que vivimos muchos en una misma casa, muchas generaciones. La abuela, el tío y todo el mundo vive. Y es muy rico tenerlo así, pero también genera la preocupación de cómo vamos a proteger a las personas adultas que tal vez estén en la casa y no estén vacunadas. What I said in Spanish with regard to the attitude is that we understand why people get confused and maybe a little bit of anxiety, and in some cases even more than that. It's just inform yourself, make the right decision for you and your family, and how you are going to protect your family and everyone else. And the first choice is always get vaccinated if you have the choice to be vaccinated, if you are in the age group. But also, you know, our concern with Latinos and other community of color is also that we tend to be in multi-generational homes. And we can not only think about the child, but we have to think about the elderly people that may live in the house with pre-existing condition. And by vaccinating everyone in the house that is eligible, we can protect that child that is not eligible for vaccination yet. So that's another tool too.
Okay, so you've heard a lot today, and just this is a big week for us. With 209,000 students returning to school, that is going to create potential new exposures for our community. So you've heard from Dr. Jenkins and you've heard from our healthcare experts. So what I'm going to suggest to everyone is that pay attention to the guidance that will be provided to our community in the coming days, and please protect yourselves. Endeavor to get tested if you feel that you need to get tested. If you want to get vaccinated, we have numerous opportunities that we have shared with you today about getting vaccinated. This is the 147th press briefing that we have done since the beginning of this pandemic. The 148th press briefing will be on Thursday here at 4:30 p.m. And I thank all of you for coming out and for being so patient and listening. I thank Mayor Dyer and all of those who participated during this press briefing today for being here.